Do you have a desire to work in the United Kingdom as either a care assistant, a senior care assistant, a nursing assistant, a clinical support worker, a domiciliary care worker, and many more, as long as it's within the care industry? Then you are in the right place. Guys, this video is very, very detailed. I'm going to be listing and giving you possible interview questions and answers that you likely be asked during your interview. So whether you're working in a care home setting, or you want to work with the NHS Trust, or even a domiciliary care setting, then you need to watch this video to the very end. For those coming across my channel for the very first time, you are welcome. My name is Khemzy, and in my channel, I talk about relocation tips, life abroad, and faith. And if you're a returning subscriber, you guys are always the best. Thank you for subscribing, for liking, for showing your baby girl love and support. I am grateful for this. So guys, let's get straight into the video. So I'll be dividing this questions and answer section into 3 parts. The first thing are direct or general question. Then we've got scenario-based questions. Then the last one are role-based questions. Now let's start with direct or general based question. A disclaimer, guys, I am not an immigration consultant. Every information I share on my channel is solely based on my experience, the experience of people around me, and my research. Okay, and the questions and answers I'm going to be listing in this video is also based on these things I listed, which is my research, my experience, and the experience of others. Okay, so don't limit yourself to these questions or these answers I'm going to be giving in this video, but this is just to give you an idea of the possible questions that can be asked. One fundamental tip I want to let you know is that when you're scheduled for an interview, the first thing you need to do is to thoroughly go through your application, because there are some applications that involve you filling a form. Okay, you might need to fill out your experience, your education experience, your work experience, your skills, a lot of things. Make sure you read through the application thoroughly. Also, the CV you submitted, make sure you go through it. Make sure you look at everything you wrote. Also, when it comes to NHS application, make sure you go through the job description and the person specification for that particular role, because in most cases the questions you're going to be asked would already be stated in the person specification. So it is important you check all these things before an interview. Now let's get straight into the direct or general questions. The first could be, tell me about yourself. Guys, you don't need to complicate this question. It's a direct question that you should answer with all sincerity. Be relaxed, don't overcomplicate it. Okay, now what I do is that I use a formula which is called the present past future formula. Okay, you telling them, obviously you start with your name, tell them what you do at the moment, tell them what you've done in the past, and outline your career plans and how it aligns with their company or with the trust or with the care home. Okay, now I'm going to be writing some examples on the screen, so please focus on your screen. All right, so please take a look at this. You can see that it's got an element of your present, it's got an element of the past and the future, and how it relates to the role. It is also important to note that you can talk about your hobbies. Tell them if you love to sing, if you love to dance, make sure it relates to the role, guys. Don't just talk about any hobbies, okay? Or if you've got siblings, maybe you're the second child out of 4, tell them more about yourself. Be relaxed, try not to go overboard, still remain professional in your response. In case you're not asked, tell me about yourself, there are other questions they might ask you that is quite similar to tell me about yourself question. So they could ask you, I would like to hear more about you. Walk me through your resume. Could you share a bit about your background? Tell me more about your journey. Is there anything about yourself that is not on your resume you would like to share? How would you describe yourself? Talk about the event that led you to pursue your current career. So these are the common alternative questions to tell me about yourself. The second question could be, why would you like to work with us? So it could be with the NHS Trust, why would you like to work with the care home, or why would you like to work with the domiciliary care? Okay, so it is important you read the company's mission and vision and ensure that it aligns with what you actually desire. Okay, so these are the things that would prove to them that yes, you really know about the company, you're ready to work with the company. Or they might even ask you, why do you want to leave your former employer? Why this trust? Why this care home out of all the numerous care homes in the UK? So this is where the mission, the vision, the personal statement comes in. So it is important for you to do your research about the company you're applying to. You can give responses like, I specifically want to work here because I read your company's mission and vision. You can even state out the vision and the mission statement. Okay, after finding more information about your company from social media, I can clearly see how my goal aligns with that of your company. You can mention that goal that really aligns with you. Okay, there is nothing I love more than when I'm working with other engaged individuals towards a common goal, and that is why I'm excited about working here. So a tip to answering this question, like I said, look at their mission and vision, look at their testimonial, look at their reviews, commendation, the CQC rating, all these things. Take a look at it, merge it together, and tell them why you want to work there. The third direct question could be, tell me about your experience in the advertised role. So this is dependent on what you're applying for. If you're applying for a senior carer role, a care assistant, a nursing assistant, a clinical support worker, it is important you look at what the job role is all about. Okay, if you've got experience, you need to tell them what you were able to do, how you were able to care for the patients, and other stuff related to the role. So this is left for you to check the job description and make your research and tell them your own personal experience as it relates to the role. The fourth question is, what are the 6 C's of care and how it relates to the role? Trust me guys, there is no one working in the care industry in the UK that shouldn't know about the 6 C's of care. So they include care, compassion, competence, communication, courage, and commitment. So these standards are what you need to carry out whenever you give care to patients. Okay, so you need to just list the 6 C's and how does it relate to the role. Care, you talk about care, the fact that you need to be caring. How does being compassionate relate to the role? You need to be empathetic. You talk about commitment, you talk about courage, you talk about communication. All these things are something that are very easy to talk about. So please make sure you practice this question. The next one is, what is safeguarding and how can you implement it in your role? So safeguarding simply means you're protecting your patients, your service user, or your residents' health, their well-being, and human rights, enabling them to live free from harm, abuse, and neglect. If you want to work in the UK, safeguarding is a massive thing. Okay, you don't joke with safeguarding. If you see any scratches on their body, if you've seen any mark, or if you see someone speaking to them in an inappropriate way, you need to report any concerns. Okay, you need to ensure you protect them from their self, because there are some patients that could actually harm themselves. Protect them from harming others, and also others harming them. So it's a big one in the United Kingdom. So the next question could be, what is dignity and how can you implement privacy and dignity in care? So dignity is the right of a person to be valued and respected for their own sake and to be treated ethically. So privacy and dignity go hand in hand. How can you implement these? We can talk about personal care. When giving personal care to your patients, ensure you close the curtains, okay? That will give them a bit of privacy so that others are not, seeing what is happening there. If you're not caring for a part of the body, ensure it's probably covered, okay? Sometimes some residents might prefer a male carer or a female carer. Ensure that the appropriate staff is provided. If they can wash themselves or they can care for themselves, allow them to do that. You don't need to do it for them, okay? If you want to touch any part of their body, you need to let them know, explain the process, whether they understand or not. So all these things go hand in hand in dignifying your residents. So the next question could be, what is a care plan? Now, a care plan is a detailed documentation of how care should be provided for a patient. So guys, when you get to a care home or a domiciliary care or even the NHS Trust, every patient has a care plan. Or even if they ask you when you get to work, what is the first document you should request for? The first document you need to request for is their care plan, because the care plan has some components which include their assessments, their diagnosis, the planning, the implementation, and the evaluation. Everything you need to know about the patient is written in the care plan. They might also ask you that when you get to a care home or a domiciliary care or even in the NHS trust, if you are asked to use an equipment that you've not been trained for, would you use the equipment? The answer is no. Guys, always say no. Whenever you're not trained to use an equipment or a machine in any company or organization, you are not allowed to use it, guys. Even if you know how to use it from your previous job or from your previous experience, as long as the company that you're currently working with or you want to work with has not trained you on how to use it, be it an hoist, be it a stand aid, or even using the bathtub, please try not to operate it. The answer would always be no, you would not operate it or use the machine unless you've been properly trained. Other questions could be, what is confidentiality? What is person-centered care? And for those outside of the UK, they might ask you why you would like to travel to the UK. Quickly, we are going to look at scenario-based questions. The questions you're going to be asked is dependent on your role and person specification. The first question you could be asked is, how do you intend to work in a multidisciplinary team? Since you're going to be working in the care industry, trust me, you're working with nurses, with doctors, with physiotherapists, with occupational therapists, and many other professionals. Okay, you can give answers like, I will understand who does what and why, because members of a multidisciplinary team will have different qualification, training, and method of working. Okay, another way you can work in a multidisciplinary team is to learn from each other, because a team is made up of people with different skills and ideas, and it's a huge opportunity for all employees to broaden their knowledge. Okay, another way you can work in a multidisciplinary team is that you respect each other's point of view. Okay, because you are able to recognize the team collaboration and also enabling every member to bring different viewpoints and skills to help achieve common goals. Other scenario-based questions you can be asked are, tell me a time when you needed to offer help to someone in need. When answering this question, you don't necessarily need to talk about the care industry. You can even talk about things like when you probably offered someone a financial help or a physical help or an emotional help. Another question could be, tell me a time when you offered a client emotional support. Okay, so if you've got experience, you will definitely know how to answer these questions. Usually when they are in their low state or in their high state, how were you able to support them? So this is something that I feel you can easily answer if you've got the experience. The next question is, tell me a time when you needed to just listen to someone without speaking. There are some times when, patients or residents are very emotional, they are angry, or they just want to keep talking. There are some situations whereby the best way to help a patient is just to keep quiet and not to say anything. So describe your experience to them. You need to picture a scenario and tell them about it. Another question could be, tell me a time where there was a safeguarding issue at a place of work. So probably maybe a patient was hurt or was harmed or something happened or there was an abuse and it was reported. So you basically need to tell them how it was handled. Okay, the process, who did you report to, how did you report it, what happened at the end of the day. So if you have not experienced any safeguarding issue at your place of work, just tell them it has not happened, but if it happens, this is the channel in which we will go about it. Oh, we're going to report to this, report to the manager will report to the area manager, and the likes, depending on how it works in your company. Okay, tell me a time when you really had to use your initiative, whether at work or at home. All these questions is just to give the employer an idea of the kind of person you are, how you can handle situation, how independent you are, how you can manage crisis and the likes. So please be truthful. Tell them when you had to use your initiative, whether at work or at home, and just try to paint a scenario to them. Okay, another question could be, tell me a time when you help someone. Paint a scenario, paint a picture to them, and try to be emotional, okay? Now, I'll quickly go to the final questions, which are role-based questions. Now, this is dependent on the specific role you're applying to. So it is important to look at the necessary skills that are required for that role, person specification, even the academic qualification that is needed in that role. Because in this case, they might ask you questions revolving around the role that you are applying to. Now, if you're applying to work with people with autism, with dementia, with learning disability, with psychosis, mental health challenges, and the likes, they might ask you to tell them about your understanding, let's say about autism or about dementia, about learning disability, or what do you understand by, psychosis or schizophrenia, stuff like that. So it is important you look at the role you're applying for, look at the kind of patients you want to care for, the conditions that are very common in that ward or in that care home, and read more about the condition, okay? They might also ask you how you are able to manage a challenge with people with this condition. So if they are quite emotional or they are not really in a very good state, how do you manage them? So this is where your experience comes in. That's why I keep saying you need to have some level of experience, okay? Because they would definitely, guys, ask you role-based questions. They need to be sure that you are qualified for the role. Do you have an understanding of what you're coming to do? How will you manage situations and stuff like that? So in summary, guys, it is important you look up the job description, look at the role, look at the task that is expected of you to carry out, learn how to do it. If you're going to be involved in taking blood and the likes, they will ask you questions relating to that and learn how to do it. Finally, guys, I will conclude by saying this. Sometimes when you have your interview, the employer might ask you if you have any question for them. Okay, don't be scared to ask them questions. You can ask them role-related questions. Also ask them questions relating to career growth and so many others. So don't be scared to ask them questions. We've come to the end of the video, guys, and I hope you've gotten value from this. I wish you guys the very best in your application and in your interview. Remember to subscribe to my channel, like my videos, please share it to everyone around you, and turn on your notification bell. All the services I offer are in the description box. Kindly follow me on Instagram and join my Telegram group, and I'm going to see you in my next video. Bye.